my name is Clarice Holden. I'm with the VA Heart of Texas Healthcare Network Vision 17.
Hi, I'm JC Newell, Director of Healthcare Technology Management for JPS Health Network.
Hi, I'm Chris Nowak. I'm with Universal Health Services. I run the Healthcare Technology Management program for Universal Health, and we own and operate hospitals across the country.
Dave Brodigam. I'm here at MD Expo in Dallas. I'm glad to be talking to y'all. Some of y'all know me. I've worked at hospitals for years. I've written several books on biomed and some other items, and currently I'm actually teaching biomeds for the up and coming generation of students.
There have been many. First of all, I think there was a lot of recognition of the status of emergency that we were kind of rolling into. We've had difficulty with staffing, with helping to adjust for folks if they had family members who got sick or if they got sick themselves, making sure that they were taken care of and making sure that we had staffing at our facilities, being able to keep up with our maintenance in time, being able to transition and move medical equipment if we needed it at one facility versus another. That was a really big challenge. And I think also being able to transition to working from home or working remotely was a really big one. Through collaboration and a lot of teamwork, there are some very good folks who work in several of the hospitals that I interact with, and I'm very fortunate in that regard. And I think everyone definitely took on this mentality of we're all in this together and we need to focus and group ourselves in order to create the best outcomes for our patients as well as our staff.
That's been a very popular answer. At JPS, COVID-19 took on a whole new meaning for us. Being the county hospital for Tarrant County, we see a wide spectrum of patients. We see the homeless and indigent. You know, we have those that are healthy and those that are physically in trouble. We also have the only emergency psychiatric room in the country. So being where we are, there is a lot of areas that we touch. When COVID happened, it was a quick increase in patients. One day you have 20, the next day you have 50 and 70. At one point we got up to 200 patients. At that point, it became a stressor in how we deliver care. Now it's where do we get the equipment from? Closing the clinic so that we can bring the equipment in-house so that we can work on patients better or provide better access to patients. For our department, it was about finding essential equipment like dialysis machines, and everyone was out of them, ventilators, making sure we rented more, beds, stretchers, just so we had enough to accommodate the patient load that we have. It was truly an amazing feat, but one that I am proud to say that JPS stood up to the challenge, and we stood as a team and a family to support our patients and our patient population and our customers. So what we did is that we had to band together, and it was our executive leadership team, Robert Early, Dr. Karen Duncan, Dina Dent, all of them stood up to the challenge to say, hey, let's get a plan in place, let's figure out how we can move this equipment, let's figure out how we can order the supplies we need and make sure that we keep them in stock. And it was a phenomenal collaboration between all of those. Our command center was working overtime. It was a beautiful execution. Our IT team was flawless to make sure that we stayed up on the network. We were able to accommodate the signals and things that we had to get to Epic. It was wonderful.
So the COVID-19 challenges that we've had to deal with, especially in the beginning of the crisis, was the supply chain, medical devices, the availability of medical devices, predominantly mobile medical devices, ventilators, infusion pumps, and things like that. So sourcing became a primary responsibility of our departments, and how we were going to provide for our patients that needed those technologies, as I said, mostly mobile medical equipment. So we overcame those challenges for acquisition of mobile medical devices through our business partners. We relied heavily on our business partners as well as ourselves. So we had relationships with certain companies, manufacturers, rental companies, and then, as I mentioned, we leaned on ourselves. So if I was spiking with COVID patients in the East Coast, one of my hospitals in the East Coast, we reached out to our hospitals in the central part of the United States or the west coast of the United States, and that's how we made sure that every one of our patients was cared for with the technology that was necessary.
Well, I would say it's the typical challenge, so you've got to make sure that you don't have too many students in a room. You have to make sure you have separation between the students. Everybody's got to wear masks. I think the one surprising thing, at least for our school, is there is some students that are doing online, but for all the biomed stuff, we're actually teaching in person. And now that helps that we just have 6 students, but we can keep them 6 feet apart. We wipe down the desk, when we finish with the room. And I actually think one of the interesting things about it is I tell them, I said, learn from this, because when you get in a hospital, you're gonna have to learn to look at everything as being dirty. You wash your hands, you're gonna have to wear a mask sometimes. It's a great way to kind of ease yourself into the healthcare field.